Hello. According to a new CDC study, COVID has tripled our anxiety levels, quadrupled our depression levels, and it has doubled the number of people seriously considering suicide. A full quarter of young people have contemplated suicide in the past 6 months. These are the so-called diseases of despair. And if we don't do something to intervene, we are at serious risk of them becoming deaths of despair by suicide, alcohol, and drug overdose. The deaths of despair had already doubled in the 15 years prior to COVID. And then recently, a study by the Meadows Mental Health Policy Institute modeled that these deaths will increase again by 20% if our employment levels stay levels. Now, you may find these numbers surprising, or they may resonate with you deeply because you may know someone who's struggling. What is special about the guests we have with us today is that each of them is finding ways to address diseases of despair in their communities with the people that they love. One thing we will learn today is that different people experience mental anguish differently. You will hear our guests talk about depression, addiction, trauma, and even a culture of diminished expectations. What is important is that these guests know the people they're trying to help, and they've crafted interventions in ways that are actually helping them. But before we begin, I do want to introduce our guests. We have with us today Owens. He's the Executive Director of Reboot Recovery, a 501c3 nonprofit that helps veterans, first responders, and their loved ones heal from the moral and spiritual wounds associated with service-related trauma. Evan, we're delighted to have you with us.
Thank you.
Dr. Annelle Primm is a psychiatrist and a nationally recognized expert in community and cultural psychiatry. In addition to being the senior medical advisor to the Steve Fund, she also advises health systems. She has held leadership roles at the American Psychiatric Association as well as Johns Hopkins University. She's edited multiple books on these issues and produced many videos. Welcome, Dr. Primm.
Thank you, Anna.
And finally, we have with us Cara Dingus Brook, who is the president and CEO of the Foundation for Appalachian Ohio. Having grown up in the area and returned after getting her education at Ohio University, under her leadership, the foundation has tripled its assets and generated more than millions of dollars in funding. Cara, we're so honored to have you with us today.
I'm grateful to be here. Thank you.
I want to point out this will be a 1-hour call. Each guest will talk first about their own community and efforts, and then we will direct discussion questions to all of our guests. Please join in with us at every point during the call. If you have a question you want to ask of any of our guests, please do so by using your Q&A function at the bottom left of your screen. I do also want to mention that a poll will be popping up on your screens mid-webinar. Please do provide your feedback. But before digging in, we want to give you a little bit more framing about what diseases of despair are and why COVID has made them so much worse. Dr. Primm, could you help us with this?
Certainly, Anna, and good day to everyone. The coronavirus, novel coronavirus, has wreaked havoc on our nation. It's a public health disaster of significant proportions. And as of today, there have been 6.1 million cases and over 185,000 deaths. This pandemic has had impact on the physical, the emotional, and certainly the economic. And these three fallouts together have certainly had a significant impact on the mental health and well-being of the nation. I think one of the things about COVID-19 that has added to the mental health impact is that people, very often, people who are infected don't know that they're infected. They are asymptomatic. And with that comes the risk of infecting loved ones, friends, neighbors, co-workers. And it's important to mention that there are certain workers in our society that are very vulnerable to infection and exposure. And those are essential workers like grocery store clerks and mail carriers and frontline workers such as those in healthcare, physicians, nurses, and other hospital personnel, and certainly first responders like police officers and firefighters. Anyway, those individuals are at risk of bringing the infection home to their loved ones, their friends, their neighbors, and coworkers. And to make matters worse, in order to protect ourselves from COVID-19, we must physically distance. And this is really a paradox at a time when, because of the fear and uncertainty around contracting the illness and the death associated with it, we would normally want to reach out and touch our loved ones and our friends and be close to them. Humans are relational creatures. And unfortunately, with the physical distancing that we're advised to engage in to protect ourselves, this keeps us away from each other at a time when we need each other's presence, the physical presence most. And so this is a huge issue, which only adds to the feelings of isolation, depression, and anxiety, stress, demoralization, and despair that accompanies this illness. And certainly people who have had pre-existing mental health conditions, the advent of the coronavirus and all of the inconveniences and stressors around it have in many cases worsened and exacerbated people's illnesses, and in some cases increased suicidal thoughts and feelings of hopelessness. This is certainly pronounced among young people, and a recent survey from the Center for Disease Control has found that young people in the 18 to 24 age range have had significant increases over 2019 in their symptoms of depression and anxiety, as well as suicidal thoughts, and as well as either starting to use substances to cope, as well as increasing the use of their substances to cope if they were already using substances. And really all of this speaks to some of the feelings of despair and the sense of hopelessness that accompanies us having to completely change our lifestyles as a result of this, and with many people feeling hopeless, like they do not want to live life in this way. So we really must be very serious and conscious of the impact that the coronavirus has had on things like depression, anxiety, and the frequency of these in our nation, and certainly underscores just how important it is for conversations like these today. Thank you.
Thank you so much, Dr. Primm. It's isolation when we most need connection. That is such a wonderful way of putting it. I'd like to turn now to the unique efforts each of our colleagues is undertaking. And I want to remind our guests, please join in with your questions using your Q&A function, and feel free to do this. If you want to target a question to a specific guest, feel free to jump in at any time. Our first guest who we're going to talk to about his efforts is Evan. And Evan, we would love to have you join us and start by telling us, please tell us about the people you serve with Reboot Recovery.
Yeah, so first off, Dr. Primm set it up beautifully for me. Thank you for that. And she already spoke to some of the issues, but Reboot Recovery serves veterans, we serve first responders, and we serve their families, specifically individuals who have encountered crisis or encountered trauma. And we define trauma as witnessing or participating in a terrifying or horrifying event or experience. And so obviously that's a lot of our military and a lot of our first responders fall into that category.
So tell us more about the challenges these people face. What kind of challenges do you face when you feel trauma?
Yeah, so even before COVID, for many veterans, many first responders, and we include in the first responder umbrella, we include a broad tent. So it would be everybody from police, fire, EMS, but also including first line or frontline medical workers, emergency nurse, correctional officers, 911 operators. And it's very common for the sights and sounds of those experiences to follow them home after their shift ends. It's not like they flip off the siren, they go home, and the memory or the experience leaves them. A lot of times, if those things are not addressed, what begins to happen is it starts chipping away at their emotional, their mental, their spiritual well-being. And sadly, so often people don't get the help that they need, and suicide or suicidal ideations have an opportunity to creep in and start impacting them. And data has actually shown a couple different things. One is that stigma is tragically still very much alive, especially in some of our first responder communities, where maybe there's fear that if I go step forward, that there won't be there will be a limited career advancement opportunity for me. But also data shows that within the veteran community, for example, the majority of completed suicides by veterans, those veterans who complete suicide aren't even connected to the VA for healthcare at all. And so they really are kind of operating almost as an island. And a few data points just to kind of speak what are some of the issues. So some may know over 20 veterans a day take their life. That number has climbed since the beginning of COVID. The number one killer of law enforcement by far is suicide. 15% of firefighters have reported one or more suicide attempts. 38% of EMS workers, these are ambulance workers, report that they have contemplated suicide. I could go on and on with data, but the point is these rates are significantly greater than the general population. And remember, these are the people that we count on day in, day out to be at their best when we are experiencing our worst. And so we need them to be healthy. We need them to be of healthy mind, body, spirit, soul, all of those things. And as Dr. Primm said, to make matters worse, many of them don't seek the help. And so rather than seeking the help and risking having it end up on their record, sadly, many choose to isolate. They choose maladaptive or unhealthy coping mechanisms. Maybe that becomes substance abuse or isolation or hair trigger anger, and then they become symptomatic. We see tons of anxiety, depression, loneliness. We see obviously insomnia, problems with sleep and things of that nature, as well as hair trigger anger or emotional responses. And the people who should most commonly be there to kind of be a rock, to be in their corner to help them, unfortunately, many times that's their spouses who have transitioned to now they're not just a spouse, they're not just a parent, but they also have adopted this caregiver role. And if you've heard of a term called secondary trauma or vicarious trauma, as sometimes it's referred to, this is a trauma where we often see the symptoms that maybe I experience as a first responder. They actually almost are contagious. They almost pass on to the people in my family. And so now the people in my family who should be the safe harbor become another source where they themselves are in need of help. And that can be very, very difficult to maintain all of those roles. And sometimes it can lead to really a state of hopelessness. And that's really why we approach the programs that I hope I get to share with you in a minute. That's the reason we approach the programs the way that we do.
Thank you. That's such a full description of challenge. And I know that these programs you've developed are specifically developed to meet each one of these challenges. Can you tell us a little bit about your programs?
Yeah, no, I'd love to. It's my favorite thing to talk about, actually. So that's perfect. You know, too often these folks, they don't deal with their trauma. And so instead their trauma deals with them, right? Instead of them dealing with it, eventually that trauma starts to control almost every aspect of their life, even activities of daily living type things that we all have to do, go to the ballpark, go to the gas station, go to the grocery store. All these things start to be impacted by that trauma if it's not dealt with. And that's why we've created what we have as Reboot Recoveries. We have a trauma healing course. The veterans and first responders who come to our course, they need the support, not just of a clinical source, but they need the support of their communities, and they're finding it through our courses. And so you might ask sort of what exactly are these courses? So let me kind of go into that if I could briefly for just a few minutes. Mm-hmm. So the courses were founded by Dr. Jenny Owens. She's an occupational therapist specializing in traumatic brain injury, post-traumatic stress disorder, things of that nature. And since the beginning now, since several years ago, we've had 10,000 people have went through our courses. And the way our courses work is like this. So at any given time, we have somewhere between 200 and 300 courses meeting somewhere within the continental U.S. Any given night of the week. That's about the number of courses we'll have meeting. And these courses, they meet one time per week for 12 weeks, one night a week for about 2 hours. At almost all of our courses, they include a meal, they include childcare, as to remove barriers for the entire family to be able to get the help that they need. Our courses are Christian faith-based, but they're also outcomes-driven, using standardized, NIH-developed, measurable tools to make sure that we're proving both a faith impact, but also a scientific or maybe medical impact. And this is very important. Each of our courses, they're actually led by peer leaders in the community. This is very important. So rather than a top-down solution, we believe in a side-to-side locking elbows solution. And so we equip these people, these peers, to become people who have lived through experiences, learned from experiences, and now are ready to lead others or help others through a facilitated discussion. So people come into a room, they eat a meal together, the kids go off to a safe childcare facility, they flip on a short video, about 10 minutes, and then the facilitators take them through a discussion for about 40 or 50 minutes, walking through a curriculum that's going to cover topics anywhere that they're all related to trauma. Things like, how do we rebuild trust after devastation? How do we rebuild empathy? How do we forgive ourselves and others? How do we deal with anger? How do we deal with a misplaced identity? All of these things that trauma really shakes the bedrock of us, both mentally, emotionally, but also spiritually. And we find there's a major gap also when we talk about spiritual resources. There is a gap. There's not very many of us out there. We're kind of unusual in that space. There's no cost to participants. And I mentioned that the child care is even included in that no cost, which is due to our incredible supporters, obviously. And as they work through this course, one of the things we do is pre and post outcome measures, and they're working. We were very, very fortunate to have our research published in the Journal of Military Psychology. Most recently, we have a few other journals coming out who are really showing that this connectedness to one another is vital, that we find that the most healing component is loving, trusting relationships. And by equipping these peer leaders, we're fostering an environment of empathy and of understanding, but also of street credibility, of like, I get it, I've been there. And this is filling a necessary gap, where there's a gap and a lack of maybe clinical resources, especially for communities where there may be stigma, or there may be just a lack of resources to be able to access those facilities. We always say that the healing from trauma, yes, it takes a course, but first it takes a community, and that it ends in empowerment. And so that's the best part, is our leaders and our graduates, man, they are awesome. They take the pain of their past and they give it purpose, and they start to help other people. And that's the most beautiful part of my job, for sure.
Wow. Yeah, that is really inspiring. So Evan, how have you pivoted during COVID to make your programs, first of all, still relevant for the people who need help, but in fact, how have you pivoted to make them even more widely available?
Yeah, I said yesterday that the word pivot and the word unprecedented should be like the drinking game words of the year, that every nonprofit I know is using those two words. Right. As soon as COVID began, we began to make those pivots. And really we did a lot of things, but I'm going to highlight two just because of the sake of time. I don't want to take all the time from the other speakers. First is we transitioned all of our courses into virtual settings, which opened up a lot of really cool opportunities that I can talk about a little more. But the biggest one is there were a lot of communities that before we weren't able to reach and serve. And now we were able to say, wait a minute, you can join, even though you're 20 miles away or 40 miles away, you can join us. And so actually our group sizes actually grew quite dramatically. Many of them doubled and tripled from the average size. Some groups having as many as 30 or 40 people show up to them, which was truly amazing. The challenge was, how do you foster that level of community and fun to make it feel like a welcoming environment? How do you do that when it's like this, right? It's kind of socially awkward. And that's been a challenge that we're continuing to kind of crack the nut on. Secondly, we expanded our audience. So while our focus has obviously been on working with veterans and first responders for many years, suddenly when COVID happened, the game shifted. We began getting calls from church leaders and other nonprofits and individuals saying, hey, can I attend your course? I'm going through fill in the blank. I've lost my job. I'm losing my home. We've got a family member who died suddenly, whatever it may be. And rather than just kind of say like, no, we can't help you, we decided to pivot. We decided to leverage our existing expertise. And we said, let's get something out quickly first that can kind of immediately be a balm to the community, if you will. And we released a thing called Reboot Crisis Edition. It was a 5-part, it's a free web series. You can download it to this day at Reboot Recovery. I think it's /crisis. But anyway, you can download it for free. And really what it did is focused on, here's all the experience we have in the natural response to trauma. Here's the most common pitfalls. And here's some recommendations on how you can avoid falling in those pitfalls of addiction, self-isolation, unhealthy coping mechanisms, all those kinds of, how do you avoid those things? And so we tried to kind of get out ahead of what is now actually being seen. And it was amazing. It actually weirdly became our most ever used resource. We put it together the fastest and it became the most used, which has been great. And it's, I think, I don't know how many people, but a lot of people have used that. And the response that at the end of that was, okay, that was great. Well, what else do you have? Can you give us more? And so we are in the process of taking all that we've learned from our 12-week curriculums for veterans and first responders, and we're writing a new 12-week curriculum that will be trauma healing for everyone. And it will be a 12-week course that takes all of the evidence-based work that we've done and faith-based work that we've done and leverages that. And it will be peer-led, it will be Christian faith, it will be small group. It'll be very similar in terms of scope, but the most exciting part is it will be accessible to a lot more people. And we're currently not only developing that, but we also are currently, funding that initiative as well to make sure we have the capacity, because we're anticipating it being quite dramatic. We piloted one group this fall and it filled up in about 25 minutes. So we anticipate it being a pretty serious need.
Evan, that is just such a fascinating pivot you made. I mean, it's sort of recognizing before many of us did that this pandemic really is a trauma that we're experiencing, and that all of these findings you have on trauma are so relevant to all of us at this point. And also, just as you said, that these people who have gone through trauma before can become the most empowered and the best guides to the rest of
That's
us,
right.
as people maybe are experiencing trauma for the first time. Thank you for your remarks. I want to turn now a little bit away from veterans and the faith-based response Evan developed to zoom in on a very specific region in our country, which is Appalachian, Ohio. Cara, I'd like to welcome you. You have lived your whole life in this area, and you've become a leader in bringing resources, ideas, inspiration to your region. I want to also say to our guests, again, please feel free to weigh in with any questions you have for Cara as they occur to you using your Q&A function, and we'll try to cover them as they come up. Cara, can you please tell us about the people you serve?
Absolutely. Our focus is on a part of Ohio that is in Appalachia. And I often start with really our story of origin. People were attracted to settle in our region by the jobs of extractive industry, whether that was coal mining or oil and gas, brick making from our clay, iron from our minerals, timbering. The names of our communities say so much. Right now, I'm sitting in the little cities of Black Diamonds, named for its coal. It's where our office is. I went to Ironton High School, named for the iron produced by that company town. Our region is where the United Mine Workers of America started, the United Steel Workers. In 2016, only one of our 32 counties voted for Clinton. In a company town, nearly everything is provided: housing, entertainment, groceries. You buy it with company script. Our communities had income, but we didn't really have ownership. The wealth flowed to Cleveland or to Pittsburgh, where it compounded with interest. And when the booms became busts, we had few assets to leverage. One friend who's turning 90 next week sort of sums up that time as it's when the churches began to outnumber the bars. And we were blessed to have our churches because they really were the early foundations of our community. They were what helped us work together to take care of each other. While other parts of our nation were beginning to develop organized philanthropy, we were worried about survival. And it should be no surprise today to learn that we have a huge philanthropy gap. We have 90% less charitable assets per capita in Appalachian, Ohio than in the rest of Ohio. And that's where our foundation, the Foundation for Appalachian Ohio, enters the picture. We serve donors who want to make a transformative or lasting impact, and citizens that have great potential to solve these deeply rooted challenges.
So tell us about some of the challenges that you're facing in your region right now.
Okay. Well, in areas with generational poverty, distress, decline, the term depression really should not be limited to an economics. An experience like our region has gone through has a mental and spiritual impact. I love what both of our speakers said before. It's certainly true. It forges resiliency, but at its worst, it can create a culture of diminished expectations. It should be no surprise that in a culture with diminished expectations, a lack of economic opportunity, you have a ripe breeding ground for what we've called today the diseases of despair. If anyone has read Dreamland by Sam Quinones, it's about Portsmouth, Ohio, and it makes a good case that the opioid epidemic got its start right here in Appalachian, Ohio, 27 miles from the Ironton High School. I mentioned earlier. There are other challenges we could look at. Many of our economies prior to COVID had not recovered from the recession. We've had a huge outflow of our youngest and brightest with youth out migration. We have income, educational attainment lagging the state. We usually do not go through all the problems, but there are a lot of them. We face barriers to quality health care, disparities in preventable diseases, cancers, longevity, hunger. And we have a lot of kids that were already living in chronic trauma, and a lot of grandparents struggling to raise children because their own children have been lost to addiction. We all know that COVID shines just a real bright light on our challenges. The one that probably concerns us the most is the digital divide. So in Lawrence County, where I grew up, we have school districts where 85% of the kids do not have high-speed internet at home. That's like 85%. As we're trying to go remote with learning, you can quickly see how the gaps will be perpetuated. And so, we really are pretty focused on that as an equity issue for improving economic development, telemedicine, as well as education.
Cara, tell us more about your programs.
So we've had a lot of initiatives. As a community foundation, we have 500 separate funds that have countless initiatives, many of which have been formed to tackle trauma and other things. In the last 2 years, we funded 10 communities, youth in 10 communities, to lead their own prevention campaigns, given them data, given them grants to do that. But I think the thing to focus on here is really what came first. At the start of our foundation, we didn't have money. And so I find it very ironic that our first campaign was not a fundraising campaign, but it was a mindset campaign. We called it I'm a Child of Appalachia, still goes on today. But the goal was to fight that culture of diminished expectation. And our theory was that we could convince people of what was possible by telling them stories of what had been possible for others like them. So we told the stories of people like Glenn. He was one of the first to jump on board and share his story. To reach adults, we had all the traditional things, billboards and media campaigns. For youth, we did an essay contest and engaged their teachers in having positive conversations with them. This coming year, we're honoring Joe Burrow, who used his moment in the national spotlight, receiving the Heisman Trophy, to shine a light back on our region. None of us will forget the tears that he described as he talked about our region, and the way he said, kids back home, you can be here too. So we've worked with him on a fund to relieve hunger. We did a big ad in the Dispatch. So, a lot of the youth in our region have just had really personal experience with poverty and with pain, if not in their own home, in the homes of their classmates. And so I think the umbrella strategy for us has been, how do we invest in youth and lift up their voices and their leadership in solving problems, all of the problems that I listed. So
you told us a little bit about how you pivoted during COVID to combat the digital divide. Can you just mention a little more about your broadband strategy?
Yes, so we set up an emergency response fund, and at first we were funding just basic food supplies, and we began to shift as we saw the opportunities to resiliency. And so we have just purchased last week 14 Wi-Fi hubs. We are providing this coming week 200 hotspots that will deploy through libraries. And then we've pulled together, one of the gifts of COVID has been collaboration, time for collaboration with a lot of other leaders to work on an advocacy strategy. So we see it not so much now as a challenge, but as an opportunity, in the sense that a $1.7 billion subsidy through a community-led process will actually generate at least $1 billion in GDP every year, far into the future. So I think that, with every challenge, there are opportunities. It's just inherent, it's just true. And, for us, COVID has really created this way to come together and to gain voice and to start to put some real plans forward to things that have been challenges for a while.
Thank you, Cara, for zeroing in on those things. Just one more question. So much of your foundation's success has been your fundraising approach. It's been very innovative. Can you just describe it briefly?
Okay, I'll be really brief. So we started with $1 million from the state government, which was highly unusual. It didn't cover our operations or our grant making. So we had to launch our own IPO. We called it an initial philanthropic offering, and we took on shareholders, 100 of them, to launch a $100 million campaign. We actually are so close to having raised 100 million that our goal is now $1 billion. And we went back to, that's really very important to the conversation here. As I watch the way the opioid challenge has spread from Portsmouth, Ohio to our nation, I think it's easy to see that we're as strong as our weakest parts. And so I really think as we talk about civil society today and the challenges and the opportunities that we have, I think giving face to the philanthropy gap, which is what the state government has done here, is really important to areas like ours and our ability to respond. And so we're lucky in Appalachian, Ohio to have a foundation like this. There are places across rural America that do not. And so as we capture this moment to advance discussions about social determinants for health and all of these challenges, I think just also being a voice for place-based philanthropy as a part of strong civil society response is really important. So I'm grateful for this chance to talk about it, and thank you.
Thank you, Cara. Dr. Primm, I'd love to have you join us again. We'd love to turn the lens now onto another group, African American young people, who Dr. Primm helps with the nonprofit that she advises. Dr. Primm, please tell us about the people that you serve.
Yes, the Steve Fund has as its focus young people of color, not just African Americans, but other young people of color as well, from adolescence until young adulthood. And many of these young people are students in high school, and we follow that age cohort through college, into graduate or professional school, or directly into the workplace and beyond. And we focus on, most importantly, their mental health and emotional well-being needs, especially during that time period.
And really as it supports their academic success and achievement as well. Is that fair?
Absolutely, because there is a connection between those two. And perhaps I'll just elaborate about some of the challenges that young people of color face. Of course, they're similar to other young people, having many of the same issues. That time period, adolescence and young adulthood, is a time in which many of the most common mental health concerns first appear. But there are some differences and disparities as it relates to young people of color, in that they are more likely than their white counterparts to report feeling overwhelmed at college. They're less likely to report that their campus is inclusive. They're more likely to report feeling isolated. And they are less likely to seek help when they are experiencing difficulties, and they tend to keep these things to themselves. They're less likely to graduate in 6 years as their white counterparts, and they're also less likely to be offered paid internships. So that's sort of a snapshot of what some of the challenges are that face students of color and young people of color in that age group.
So just when we're wanting to celebrate their success in graduating high school, which is this, a huge achievement, and going on to college, it's almost as if this additional number of challenges greets them. And this is really the challenges that you focus on helping with.
Absolutely. And the Steve Fund has developed a suite of programs and approaches to address some of these issues that young people of color are facing. We deal with it through knowledge and thought leadership with our convenings. We've held many of them over the past 5 to 6 years at some of the leading colleges and universities in the country, Harvard, Stanford, University of Michigan, et cetera. We also have a knowledge center online where there's a lot of information about the mental health of young people of color. We have engaged in programs and strategic partnerships in which we've offered workshops to students, to families and parents, to campus leaders, as well as to nonprofit organizations and agencies to increase their awareness and their capacity to serve the mental health needs of people in this age group. We also seek to promote awareness and dialogue through our social media campaigns, and we aim to have an impact through technology, delivering resources to young people that they can have at their fingertips at low cost 24/7. And finally, we try to drive systemic change through the Equity and Mental Health Framework, which we developed with the JED Foundation. Our goal there was to create a set of recommendations and implementation strategies to help campuses create environments that are conducive to the mental health and well-being of young people of color, and by extension, all students. And so we have a number of campuses that are engaged in implementing that framework to improve their capacity to serve the wide diversity of students on their campuses.
Well, when COVID hit, you made some very quick adaptations. Can you tell us about some of the things that you have done specifically to address the challenges presented to these children and adolescents because of during COVID?
Absolutely. And as I lead into that, I'd like to share how COVID has affected young people of color. First of all, their parents are more likely to be essential workers and on the front lines with greater exposure, and therefore a greater risk of having the infection and dying as a result. And I think many people are aware of the disparities in infection rate and death among communities of color. This affects young people, and it means that they will have experienced some losses and some trauma related to that. Also, people of color are overrepresented among those who were severely impacted economically by COVID-19, resulting in, unemployment and lack of income, which has an impact on young people's schooling. Also, their families were less likely to be able to work from home. They have less access to technology and to internet connectivity. All of these are disadvantages, not to mention higher rates of anxiety, depression, and concerns about contracting the virus. So with that as a backdrop, the Steve Fund has pivoted and actually developed a navigating a new normal initiative, which involved a number of aspects. First of all, we developed a series of webinars called our Community Conversations. And in those webinars, students, educators, mental health professionals, and others shared their insights about coping with COVID in terms of mental health. We had a series of customized workshops as well. We've shared a wide variety of resources in our knowledge center about coping with COVID, and also dealing with the trauma of systemic injustice, which is an overlaid stressor on top of COVID-19 that young people of color have been contending with. We also established the Steve Fund Crisis Response Task Force in responding to COVID-19. This included mental health professionals, higher education administrators, and corporate leaders for them to ideate solutions and recommendations on what can be done to address some of the mental health needs of young people of color in this transitional age group. And the report on this will be issued later this month. And also, it's been, very important to listen to students, to engage in cross-sector collaboration, and to come out of the silos in order to be able to achieve the most impactful recommendations. Those are some of the main things that we've engaged in, and perhaps I'll have an opportunity to talk more about the technology aspects as well.
Well, I would love to have you just give a brief overview, because it is really interesting what you're doing with technology and how you're adapting it for the people you're helping.
Thank you. One of our technology partnerships is with Crisis Text Line. And this is a service that is available 24/7 to young people. All you need is access to a phone that has the ability for the person to text. And what we're finding is that the top 3 concerns that texters reach out to the crisis counselors with, who are trained, are anxiety, depression, and relationships. And I'm happy to report that this is such a useful and beneficial and helpful resource that there actually been several saves of young people who had suicidal thoughts and plans. And the crisis text line counselors were able to intervene and make sure that authorities were able to rescue the young person and get them to the emergency help that they needed. Another one of our partnerships is with Persistence Plus. And this is a technology innovation that revolves around text-based nudges that motivate behavior change. This has been particularly helpful with college students who may have had kind of a shaky feeling about their college attendance and worries about their ability to perform and graduate. And the Persistence Plus nudges and prompts that come through text messaging, they help to increase college identity, help students develop more of a positive mindset around their academic participation, and give them a sense of hopefulness in their ability to achieve. And what we found is that when you compare students who use this tool compared to those who don't, there's a 12% improvement in academic persistence in college to graduation. So we're very excited about that partnership and the kinds of results that we're seeing. Finally, 7 Cups. We have a partnership with that organization and online resource for therapy and chat. The Steve Fund has established a young people of color group that sits on the 7 Cups website. And what this is a compassionate place to discuss issues around mental health and emotional well-being. It's a place where young people can not only receive support, but offer support as well. And there are 2 kind of areas. One is through one-on-one chat, which young people can access 24/7. There are also group chats that occur and forums on different topics, including COVID-19 and mental health and how to cope with discrimination and microaggressions and that sort of thing. And this online chat function and young people of color group boasts 6,000 members, and it really underscores the value of real-time online programs and services. And young people have been very pleased. We've gotten high rates of satisfaction with the use of this resource.
Dr. Primm, thank you. I'd like to ask all of our panelists to come back on screen now to join us for a discussion time. And I'd like to note to our participants that you may be seeing a polling questions come up on your screen. Please do take a minute to answer those questions. And please also feel free to jump into our discussion with any questions that you have of your own that you want to direct to our panelists. So I want to start with the observation that all of you are using technology during COVID in incredibly innovative ways. We've talked about the fact that Dr. Primm, whereas you take general tools and you've made them targeted for the population that you care about, Evan, you are taking a tool that you developed around a very specific group of people and realizing that you can adapt it to a much larger group. And Cara, you too are working in a way with broadband and these essential fundamentals that are needed to make tools like this available to the people in your region. What do you think this tells us? And I can direct it to all of you.
I guess what I would say to that is that it shows you that models can, if a model works, you know, in a certain population, rather than reinvent the wheel, if you have a very specific population that you're working with, that you can tweak that model and adjust it and customize it so that it fits the population that you're working with. It just requires a little creativity and an imagination to convert it and customize it to the population that you're focused on. And I would say for Crisis Text Line, that's an example of what the Steve Fund did by making sure that the crisis counselors were culturally trained so that they would be prepared to understand and work with the young people of color, you know, who would be utilizing that service.
Yeah, I guess I would just add to, again, I feel like I could just hire you as my spokesperson. That's amazing. But I think that for us, the other thing that it's also kind of showing us is that while you can work through these different populations, I think that there are some things that are almost great equalizers. One of the things we talk about is footholds to help climb out of the bottom of the valley. Some of us do have a little bit more scaffolding that makes it easier for us to be resilient, even makes it a little easier for us to bounce back. Some of us don't have that scaffolding, but there's other people who maybe didn't have it either, who are down there. And I think there's two approaches. One is to stand on top of the hill and shout down instructions on how to build scaffolding. Another is to meet up with somebody who's actually been down in the valley who can say, I've been here before. I know how to build scaffolding. I know how to get out. And that's why I believe so strongly that our model adapted because of the peer nature. It wasn't about what Evan or Dr. Jenny Owens knew or about what anybody on my staff knew how to do. It really wasn't about us or our experiences at all, and still isn't. It's about what that peer who can say, you know what, I know how you feel because I've actually been there. I've actually dealt with some of those same feelings. And I think we're missing a real degree of empathy in a highly kind of pathologized clinical community. There's a degree of empathy that's been lost in the healing environment. There's also been a loss of community-based healing, sort of a common sense counseling, if you will, that sometimes has been diminished as we focus so heavily on much needed and necessary clinical solutions. Sometimes I think we've overcomplicated stuff that maybe our ancestors knew. Sometimes what you need is somebody who's going to say, man, I'm in this with you. Come hell or high water, we're in this together. And sometimes that's enough to be able to pull you through a difficult season. Sometimes.
What I would say just from our area is that we have so often felt cut off from world-class educational opportunities, telehealth, mental health, behavioral health, and so on and so forth. And so it gives me great hope that there are these new ways of working. It also reinforces to me that we need to start thinking about internet access as a basic, just like roads and telephone and electric and water, if everyone's going to have equal access to opportunities. And I should have said earlier that when we're talking about a $1.7 billion subsidy, it would be deployed through a community-led process, which is what's different than how we're doing it now.
So all of you have seemed to be able to not just adapt, but almost to find a silver lining during this very difficult time of COVID. How do you think you are able to do this?
I guess I can go first. I don't know what the order is here. I'll go first. I think a couple things. One is I think we kept our team nimble all along. I think organizations that refuse to be quick to adapt, I think, are finding themselves in a difficult situation. But I think for us, we realized, one, it allowed us an opportunity to reach audiences that we previously couldn't reach, even geographically or capability or time-wise. Many first responders and veterans, they work in an interesting sort of shift type schedule that sometimes our standard every week for 12 weeks, come into the physical meeting for 2 hours wasn't very possible for them with their swing shifts and other things, or training deployments, things like that. And the online situation, we've got members logging in from Iraq and Afghanistan and Syria and places like that who are logging into virtual groups based out of Pittsburgh, Pennsylvania, because that's where their family is. And I think that's a really cool opportunity that it afforded us. And the other thing is we've doubled down. I think a lot of organizations have doubled down on creating very easily shareable content that is digitally accessible for free to everybody, and kind of giving away things that maybe once we've been like, well, we should charge, or we should. I think right now we're trying to just take it, slice it up into manageable bites and say, here's some stuff, like it can help, here it is. And that's another thing that I think has helped us hopefully reach more people.
So I don't know, I'll go middle this time. We were talking and I shared with you, I'm a 2-time cancer survivor. And one of the things that has helped me through that has been sort of the hero's quest, and knowing that sometimes you are forced into an underworld and you will have challenges that you don't anticipate, but you will meet messengers that will teach you things, and you will emerge somehow better able to help others. And I think that was sort of the frame that we took as a foundation, because usually, you're thinking of a theory of change and you're using evidence to make a difference, and we were suddenly shooting by the hip and we didn't even know where our targets were at first. But the messengers came, it became clear what we needed to do. And, I think that even though I talked about so many challenges from our first sort of staff meeting, we sort of thought we can't waste a good crisis because we are the lucky foundation in this region in the position of strength to respond. When we surveyed our nonprofits, 20% of them didn't have operational revenues to get through the year. So, I think it's the same things that help us be adaptable to tough situations. We can learn and we can grow. And that opportunity is always there with the VAD.
I think one thing that COVID-19 offered for the Steve Fund is to basically serve up on a platter the issues that had been our focus, and that is mental health, as well as some of the racial disparities that exist in our society with all of the social determinants of health. So it kind of made our case for us and underlined it and underscored it. And I think gave it more attention, gave these issues more attention and more of an opportunity for us to spread our message, with, in this case, using COVID-19 as a vehicle for how that made things worse for this particular population. But it really drove the point home that these disparities are real and that they have a significant impact on people's life trajectories if we ignore them.
So what advice do you have for philanthropists who are eager to make a difference in the mental health needs of the people they're caring about in their communities? And they may be different communities than the ones that you are focused in on. But what are some of the universals that you think could be helpful to all philanthropists who are trying to address these diseases of despair during the time of COVID?
I guess for me, what comes to mind is that philanthropists should think about a population or an issue that they resonate with, and whatever the challenges that population or is having or is associated with that issue, to think about what are the barriers to getting around that issue, what are the mediators that could make a difference. Really basically finding the levers, and then once you find those, determine where could you make the best, the most impact. And I feel like it's a thinking process to arrive at an area or group that you're passionate about, and really zeroing in on where you can really move that lever and make a difference for the kinds of outcomes that community or issue wants to see. Of course, one should not do that without speaking with the people who are affected. You know, nothing about us without us. The people who are affected need to be at the center of that equation and guide, you know, whatever needs to be done. In fact, that's where you get the information about where those levers are and the things that will really make a difference in outcomes.
The process for us in doing that was setting up our emergency response fund. We just did it right away, and it was very atypical. Usually we deliberate and we have clearly defined objectives before we'd start a fund. And we just called for ideas. It was a very vulnerable place to be in, where you didn't know how much money would come into your fund, and here you were publicly saying what needs to be done. But somehow it all worked out. And as we funded and as we started to work, you know, what we really needed to emphasize became clear. But it was, for a philanthropy, it was a very vulnerable sort of position to be just giving up, you know, the power and what it is we're trying to do, and just saying, we're here to help, tell us where we're needed.
And I guess I'll answer last on this one. I think the best thing to do would just be give all of the money to Reboot. That'd be the simplest. I'm just messing with you. That's not. No, I think
coming to Appalachian, Ohio.
Right, exactly, yeah. But no, I think the thing is we need to look for programs that that empower people to recycle their pain, not throw away their pain, that allow their pain to become something. You know, people should be recycling centers, not trash dumps for what goes through. And I think a lot of times what happens is we need to look for low-cost, scalable, community-based solutions that are not top-down necessarily as much. I think those tend to get all the glory, and honestly, a big chunk of the funding is if they have a bunch of doctors who have done such and such. But the truth is, when you talk to people who have gone through trauma, a lot of times they don't really want to talk to those people. They want to talk to people. I love the quote. I'm going to steal it. I'm going to probably put it on my Instagram today because I think it should be mine. Is nothing about us without us. I mean, that is so strong. And I think that's what we need to fund, is programs that are side by side as opposed to only top down. That peer leadership is what I really believe is working. I believe that's the next great wave of philanthropic impact. And we also need to engage communities of faith with that. I think that's going to be a vital piece of the pie for us in every community.
I'd like to change the conversation just a little bit here to focus us on a question from one of our audience members. The question is to Cara. Cara, you spoke of Appalachian community members feeling cut off from world-class telehealth. Does the Roundtable maintain a list of world-class telehealth resources or a guided tour through them? Example, openpediatrics.org. And this is actually a resource that has been developed by one of our members, one of our philanthropic members. So we do actually focus a lot in telehealth, and we do think that this is just an incredible opportunity for, for basically every community that's been underserved, every community that's had trouble with access. And it's another area it's actually another area that COVID has shown a lot of light on, and that has become an opportunity during COVID. Because I think it's been something that during COVID, we've all been able to go to doctor visits online, and we've all been able to realize that that's actually something that works, pretty well, actually. So, our time is kind of drawing to a close, and I really want to thank our panelists. I want to thank everybody who joined us on these calls. This actually marks the end of a two-part series on COVID and the diseases of despair. We are really grateful. I mean, I'm personally just extraordinarily grateful to hear about the resilience that your communities are showing, these communities of color, these faith communities, veterans communities, the rural communities. I want to thank everyone for tuning in. To our guests, Cara, Dr. Primm, Evan, thank you so much for the ways you've given us hope and inspiration and insight during these challenging times.
Thank you.
Thank you.
Thanks.
Thank you, guys. I loved listening.
You all were amazing. This is amazing. Thank you so much.
Thank you.
Bye-bye.